At the end of the day, it's all about the patients, the people who find themselves in need of medication to improve their health or even save their lives. In an ironic and tragic twist, sometimes it's the overuse of effective medications that can cause the most devastation. Since the advent of antibiotics in the early 20th century, millions of people have been cured of all manner of bacterial infections. But with more of these patients being treated, these revolutionary drugs are starting to backfire on us. As bacteria evolve and resist antibiotic drugs, it's having a devastating effect on many patients. More than 2 million people have contracted painful, even deadly illnesses as a result of the overprescription of antibiotic medications. 23,000 die every year.
I suspect I had a mild case, which is fortunate. Well, actually, it was my husband who was very sick.
Ellen Netting and her husband were both prescribed antibiotics after undergoing dental procedures. They both ended up with Clostridium difficile, also known as C. diff, a painful ailment that results in excessive diarrhea and abdominal pain. C. diff can occur as a direct result of taking antibiotics.
He kept having very bad chronic diarrhea, and we thought at first it was maybe food poisoning. We'd eaten the same thing, so that didn't make a lot of sense, but you give it 24 hours or so when you kind of think about it. But after he got worse, all of a sudden I began to get it, so I figured maybe it was something contagious. So he went to his physician and was diagnosed, and it was obvious that I too had C. diff.
This is Mason Wells. At 54, she had colon surgery. The surgery was successful and she was recovering. But when she got home, she developed severe diarrhea. It got worse as the weeks passed. Mason had also contracted C. diff. She was highly contagious. Mason could have easily spread C. diff to her loved ones. It took her 9 months to recover. She couldn't leave her house, work, or spend time with her granddaughter. Evolution is certainly a wonder. Animals and plants and cells, they're all programmed to adapt and to resist. It's genius, really, creating the condition that keeps life living eon after eon. At the microscopic level, that includes bacteria. Bacteria are champions of adaptability and resistance. How resistant? When researchers found bacteria hidden in a cave 1,000 feet below the ground, they saw the bacteria were already resistant to 70% of antibiotics. That resistance and adaptability are hardwired into bacteria.
Bacteria under optimal conditions can go from 1 cell to 5 billion cells in 12 hours. So imagine the incredible selective pressure you have even from a single dose of antibiotics. That population of bacteria can completely, have evolved, even within a very short period of time.
That brings us to antibiotics. They were a significant scientific discovery. Just about any infection that would have wiped out thousands or millions was cured. But this discovery has come with a price. The ever-increasing number of times antibiotics were prescribed led to the overuse of antibiotics. The result was a decreasing effectiveness and increasing side effects and illnesses.
We're already talking about a return to the pre-antibiotic era. So we sort of grown up in a time where we had them, we expect that they'll be there, but they won't unless we do something different. It hasn't even been 100 years since we've had them, in modern medicine.
The concept is as simple as it is alarming. Inside our gut, we have our microbiome. It's our bacterial environment. It's natural to us and helps us fight off disease and infection. Overprescribing or over-ingesting antibiotics wreaks havoc on the microbiome. We have germs. Some are drug-resistant. Antibiotics kill the bacteria causing the illness, and that may seem like a victory, but that leaves room for the drug-resistant bacteria to grow. Some of those bacteria give that resistance to others. Eventually, bacteria can become completely resistant to all known antibiotics. And it's not simply overprescription antibiotics to humans. 84% of all antibiotics are used in animals, and 70% of the antibiotics used in animals is non-therapeutic. They're not sick. They just give it to animals because it makes big, fat animals.
So your steak that you bought from the store, that animal had been fed antibiotics to make it big and fat. And the E. coli in that meat actually has resistance to certain antibiotic classes that also are used in humans. So let's say you handle the meat, you don't wash your hands super well, you inoculate yourself. Now your E. coli is resistant to that class of antibiotics. You get a urinary tract infection. Now that class of antibiotics is not going to work. And that's one way you can actually acquire resistance.
If we do nothing, if we ignore the problem, more and more patients will be affected.
By 2050, 10 million people per year will die from antibiotic-resistant infections if we don't do anything different than what we're doing now. That's one person every 3 seconds. That's more than's projected to die from cancer in 2050 at a global cost of $100 trillion.
How do we fight it? We have to take it seriously. Experts recommend 4 steps to get started with an antibiotic stewardship program. First and foremost, we must make a commitment. We must implement at least one policy or practice to improve antibiotic prescribing, assess whether it's working, and modify if needed. We have to monitor antibiotic prescribing practices and offer regular feedback to clinicians, or have clinicians assess their own antibiotic prescribing practices themselves. And perhaps most importantly, we have to make sure the world knows what's happening by providing educational resources to clinicians and patients on antibiotic prescribing. In other words, it will take all of us to turn this tide. Healthcare providers and organizations from Virginia to Maryland are starting to join forces to begin a new era in antibiotic stewardship. And we need you to take action as well. If you're a doctor, think twice before writing a prescription to cover a patient who most likely has a cold or virus. If an antibiotic is necessary, warn patients about the risk and symptoms of C. diff. If you're a patient or caregiver, it means asking what you can do to treat a cold or virus, rather than expecting antibiotics to be provided. And it means taking all of your antibiotics if you do need them.
It's very important to know the difference between bacterial infections and viral infections, because antibiotics do not address viral infections. And a lot of times I think, even patients may go in and say, I want an antibiotic, because they know they're suffering from whatever they have. But if it's a cold or something like that and it's viral, then it's not going to help you.
It'll take all of that, and it'll take coordinated efforts and dedication, a real commitment to addressing the issue. It all starts from identifying that it is a major issue.